Medicare guru, Ethan Dickerson. He leads our Medicare and healthcare team at Wealth Financial Services and Tax Advisory. We know we get a lot of questions, and we just want to be proactive and kind of see if we can answer some of your major questions. The biggest question we have when it comes to Medicare is, what does Medicare not cover when it comes to retirement? So we thought we'd kick a few questions to Ethan, and maybe you can take that first one for us.
Yeah, so when we're talking about Medicare, when we're talking with the financial team and trying to bridge those different gaps, the one gap that Medicare has, no matter whether it's Medicare Advantage, Original Medicare, or the Medicare Supplements, no matter what plan you're enrolled in, is the long-term care. Whether you have a Medicare Advantage plan or a Medicare Supplement, Medicare only covers up to 100 days in those nursing facilities, those long-term care rehab facilities. So once you get past that point, then Medicare's not going to cover anymore. And unfortunately, you see a lot of ones that having to shuffle around care, having to worry about Medicaid, spending out assets. And that's one of the biggest gaps, that none of those Medicare Advantage, Medicare Supplements, no matter how much you pay for those plans, will cover that. And that's where one of the biggest gaps that Medicare has when it comes to your coverage and everything.
Thank you, Ethan. And one thing, as a firm, we're a one-stop shop where we do full planning, and we want to cover that gap after 100 days and make sure we have some long-term care, maybe alternatives, to make sure that doesn't dramatically affect your financial future. So that's one thing that we do, but also we do a lot of IRMAA planning and Medicare excess premiums. Ethan, can you talk about that and kind of how you play that into the Medicare plan?
Yep, so Medicare Part B, as in boy, will specifically look at your income. Now, they don't have your current income, so when they're looking at your 2026 premiums, you haven't filed your taxes yet, so they have nothing to base it off of. So they're looking at your 2024 income, technically. So they're looking at your 2024 tax return. And based on your modified adjusted gross income, which simply put is just your AGI, your adjusted gross income, plus any tax-exempt interest you may have on your federal tax return. And they're looking at whether it's a joint or individual tax return, they're looking at the total picture. And based off of that, then they can pay a higher premium for your Part B. So in 2026, your Part B starts at $202.90. If your income's below $109,000 filing single, or below $218,000 filing joint. And where that IRMAA planning comes into play, that income adjustment amount, is because if your income's higher than that, then you start getting hit with additional premiums based on that 2-year look back.
No one likes paying those.
No one wants it to pay more than they have to for it. Now, one thing that you can do though is if you stop working, you can then file an exception to have that reduced on to have them look at current income and estimate. Now, they'll double check your work during tax time and everything, but you can then file that exception to get reduced, which is a really powerful time if you know within those couple years you're going to be retiring when it comes to Roth conversions, because it's not just your W-2 income they're looking at any taxable income, RMDs, that you may be getting hit with. So that's where planning for that IRMAA, knowing that there's a lot of advantages to the tax side of things, Roth conversions, and potentially be able to plan it out. They may not have to pay that income adjustment based on work stoppage and working that system a bit for it.
So just to clarify, Ethan, so say someone's making a lot of money, they turned on their Medicare, they're in September, but they just retired in September, they can file for that exemption and not pay those extra Medicare premiums. Is that true?
Correct. Anytime that you then end up going onto Medicare, you don't have to wait for a specific time period to file that claim. Once you get that notice from them, you can submit that adjustment right away.
Awesome. So I heard there's something about this new Medicare Part B premium and some updates in the new Medicare laws. Can you elaborate more on that?
Yeah, so the Medicare Part B premium, like I kind of previously alluded to, went up about 10% this coming year for 2026. So it was $185 this year. Next year it's going up to $202.90 for the base amount, again, before any income adjustments.
Gotcha.
The other thing that Medicare will adjust is also your Part B deductible, which is specifically the deductible when you go to see your doctors or see a specialist. Outpatient care went from $257 this year to $283. Those numbers get released each year, so they finally just released it this past Saturday in November, but they can release it any time in the fall for it.
So I heard something about Medicare clients don't have to worry about Part D anymore. What does that mean?
Yeah, so one misconception I've been getting a lot of talking to clients is thinking that agents as ourselves, licensed agents, don't handle prescription drug plans anymore. And part of that misconception is just out on social media, a lot of agents are talking about how we don't get paid a commission on prescription drug plans right now. A majority of the drug plans nationwide don't pay commissions anymore. But we can still definitely handle those things. That's one of the most important things to review each year. So while we don't get paid on it, by providing good service to clients, that's the most important thing. So a lot of agents may not want to handle prescription drug plans. That's not our philosophy on it. They tell them to go directly to Medicare.gov and do it yourself. And it can be a great resource, Medicare.gov, but it's also not, won't be able to explain it like an agent can explain it to you as well.
And just to reiterate, we brought in the Medicare and this healthcare team to provide value for clients because there's a lot of questions out there. You can Google things, you can chat GPT, but to have that one-on-one, understand your situation, be able to guide you through that, that's what Ethan and the Medicare team really provides, because we don't want people to be worrying and wondering about, is this the best plan? Am I in the right coverage? And Ethan, I actually had this week, someone's like, well, I love my plan. I've been on it for 5 years. I don't want to change. Even though they may not want to change, should they get it reviewed?
They should. And partially some of that is sometimes the insurance company, depending on the exact plan, there can be slight changes from year to year that you may not realize, or there may just be a better option even within the same insurance company. So maybe you really like that one insurance company. They may have a different offering that fits your specific needs. Or maybe there's a way to be able to reduce the premium you're paying. Maybe you've been on it for 10 plus years, and now you can go through some health questionnaires to get it reduced as well, the premiums for those Medicare supplements. So not that you have to change companies. Maybe you love that company for very good reasons, but even internally in that company, you can get a lot of a good savings and everything for it.
So just to recap, we can potentially keep the same company, lower your costs, get a better plan that fits your needs just by getting it reviewed. Is that correct?
Correct, yep, yeah.
So you guys don't all see Ethan and his team's schedule, but they are back-to-back during this time. And is it to December 7th? Did I get that right?
December 7th, yeah.
December 7th. So if you have some Medicare questions or you want to kind of review your coverage, we have a limited window over the next few weeks. Give us a call. Hopefully we can review that, save you some money, and get you a better plan. So let's talk about some other questions. Let's think forward. We're always thinking long-term. 2026. What are the major changes that's going to happen when it comes to Medicare?
Yeah, so what we're seeing more and more with Medicare specifically is on the prescription drug side of things, the Medicare Part D, that we've already kind of briefly talked about how it's so important to review. And that's because Medicare is getting more strict on these insurance companies to be protecting the consumer a lot more. So putting actual limits on it, where 20 plus years they've had drug coverage, there was no limits.
Sure.
I'd see some pay for $5,000 on these expensive medications. Now there's a limit of $2,100 next year for 2026. Now, even though the Medicare picks up a majority of the cost after you've hit that limit, you don't pay anymore, these insurance companies still have to pick up a portion of that. And they're still learning the new statistics for it. So they've been used to the old system for 20 years. They knew how to work the system perfectly, and they're still figuring it out. So we're seeing on the original Medicare side, if you have just a standalone Part D plan, we're seeing a lot of premiums increase quite a bit because that's their only way to be able to adapt. We're seeing on Medicare Advantage plans more reduction in benefits, a little bit less dental, vision, hearing, and all these companies have different philosophies on how they handle it. Some more perhaps reduced added benefits, some have added deductibles or increased premiums. So we're really seeing a big change driven because of these drug plans being better for the consumer. So it's a better overall thing, but they're still adapting. You're going to see a lot more changes than you have in the past couple of years.
A lot of changes coming. We just want to make sure you're prepared and we're ahead of those. So if you have questions, reach out to our team. We're happy to help with that. Sometimes people have been asking, is Medicare Advantage, is that going away, Medicare Advantage? You know, is that going away?
So there's definitely been a lot of changes nationwide. And a lot of it depends on the area you live in. So in the Chicagoland area where our office is located, we didn't see too much change.
Gotcha.
We saw some of these plans that were not profitable for the insurance companies to go away, or they downsize a little bit and focusing on the more profitable areas. But nationwide is still one of the most popular options for it. 55% nationwide are on Medicare Advantage. In the Chicagoland area, 63% are on it.
Wow.
So we're definitely seeing some changes, and they're all of it's adapting to these prescription drug plans. They're just trying to be more profitable. They're trying to be more niche-like as well. We're starting to see a lot more actually newer plans on these plans for those who have chronic conditions to help for diabetes or heart care and everything like that. So we're starting to see more of that changing and adapting. That's not these broad market plans, and that's what they're kind of getting rid of. They're trying to focus on more specialized situations.
Okay, so I talked about Medicare Advantage, but some people might be asking, what's the difference between a normal supplement and Medicare Advantage? So let's go a little bit deeper there. Tell us the difference between the two.
Yeah. So Medicare Advantage has been around since the 90s and all. So they aren't new by any means. That's sometimes a common misconception. But as we see them today, those are similar to group insurance is the best way to relate it. They have PPOs, HMOs, and that's another misconception that they think it's only HMO, which is not the case for it. But they work like a group insurance. So unlike original Medicare, there's very little prior authorization with original Medicare. You go to get the care that you want, when you want it, and they won't question it typically. But you pay a higher monthly premium for that type of convenience. A Medicare Advantage, they can have prior authorization before getting an MRI, for instance. So they may have to have the doctor fill out paperwork. And in this day and age with technology, it's very quick. Doesn't take 2 weeks to get that approval. You can get it overnight sometimes. So there's definitely more of a restriction with Medicare Advantage, but you also get a lesser premium. You sometimes get added benefits to it, dental, vision, hearing, depending on the plan for it. And that's overall, not that original Medicare has no prior authorization. There's a few instances. Yeah. But really the key difference that I always tell clients, it comes down to what you're comfortable with and what the convenience aspect. Original Medicare, you pay a higher premium, but you get very easy coverage. You don't have to worry about co-pays much at all. Don't have to worry about networks, but some would rather pay that little bit lesser premium, get those added benefits. So a lot of it comes down to is not what your neighbor's on or what your family's talking about. It's what you're personally comfortable with and fits your specific needs.
So Ethan, sometimes I talk to people that we do Medicare and like, oh, are you a fan of Advantage or are you a fan of traditional? So I kind of say, maybe correct me if I'm wrong, I say we're neutral. We just want to see what your preferences are, what your situation is, and then we tailor that plan based on your goals. But tell me if I'm wrong in that assumption.
No, that's exactly right. I think there's definitely pros and cons of both of those routes. Mm-hmm. Some are comfortable with those cons, some are not. And really it comes down to what your personal preference is. In our business and all here, about 50-50. 50% are Medicare Advantage, 50% are supplements. And those that are in those love those plans and want to stick with those plans. So it's really just being an educated consumer, educate about what the pros and cons are and fitting that specific need.
And when it comes to education, just to go a little deeper, correct me if I'm wrong here, but it's about making sure that you're on the best plan, but you're also not overly exposed to out-of-pocket costs. Mm-hmm. A lot of people worry about out-of-pocket costs, and there's a pro and con to each of those plans, but that's something that we want to make sure we do educate people on what the cost is and how much they're exposed to. Is that correct?
Exactly. Yeah. We always want to think, hopefully you don't have to worry about the worst case scenario, but you need to be comfortable with those worst case scenarios. If on that plan, if that happened, chemotherapy, multiple hospitalizations, that you're in a plan that you're comfortable with that potential financial risk for it.
So hopefully we all have seen the wealth of knowledge from Ethan and our team when it comes to Medicare and kind of planning for these things. So some people might be thinking, man, this is going to cost a lot, man. This is a lot of information. How are they going to provide this value? So Ethan, I just want to be very transparent. How much do you charge for all this value that you provide to the clients in the area?
Yeah, so we don't charge anything. We actually aren't legally allowed to charge any fees. If we're a licensed agent and everything offering these plans, we get paid by the insurance company. Now, more or less, they're pretty standardized by the government as far as actually what we get paid. So it's not that these insurance companies are paying us more than another. We're here to find a plan that fits your needs. Whether you go directly to the insurance company and cut out an agent, isn't going to give you a better plan or cheaper rates or anything like that. They're the exact same plan whether you go to an agent or not. The difference is that unbiased opinion, being an independent agent, sorting through your needs and being there not only now during the enrollment period, but throughout the year if there's a problem, question, concerns with claims. That's where our team comes into play still year round for it.
Yeah, and some people can call that 800 number to the company, or you can call our team and you actually get someone live that picks up the phone and it can guide you through these things and actually knows your situation. So just recapping everything, we are also an independent fiduciary firm. We help people with all different types of investments and plans. Healthcare is one aspect of what we do in our safe and secure retirement roadmap. We also do legacy planning, income planning, investment management, and tax plans at the center of everything we do. So just want to finish with taxes. I think we already talked about Medicare excess premium. No one wants to pay that. So when we do tax planning, we collaborate with Ethan and his team to make sure that we're on the best plan. Maybe they're just retired this year. Maybe we can file that exception so we can do more Roth conversions and still not pay more Medicare excess premium. So we are a one-stop shop to help you with all your needs. If you, though, are interested in some questions on Medicare, we have a few weeks left. Give our office a call. We will help you. We're here to serve you. And thank you for joining us live. And if you see this on the recording, I'm glad you watched it. And please subscribe and see how we can help more people just like you. Thanks again.
Take care.